It's our pleasure once again at Channel 18 to welcome our cohort here in the building, Barbara Ann Foley, Director of the Council on Aging. And Barbara Ann is going to tell us about a very important subject and something that we have a lot of probably in our homes, and what we should be doing with pills, Barbara.
Well, there's a lot to this particular day. It's called Take Back Drugs Day. And basically across the entire United States, this particular day, Saturday, October 29th, from 10 a.m. to 2 p.m., there are going to be collections across the United States. In our case, it's our local Harwich Police Department. You can't get any closer to us than that. And they are collection sites for what, you say? Well, if you look behind me, you can see all kinds of different looking pills. And what happens a lot, I actually, when I went to the Mass Council on Aging conference this October, I learned something very important that I didn't know. And that is, a lot of people will say, well, I have an antibiotic. It's only a year old, and I've kept it because in case I need it this winter, then I don't have to waste the time and the money and everything else going back to the doctor, because I know when I'm sick and I know when I need it. Well, for one, that's really, really bad medicine, trying to self-diagnose yourself. But more importantly, too, what I didn't know that I learned is that everybody thinks or has been taught that all medicines and drugs, when they expire, it just means, this is what I was taught, that they're less potent, right? That's what most people think. They're just a little bit less potent. So instead of 1 a day, you might have to take 2 a day if it was a year or a couple years old. Well, what I found out is that certain medications, after their expiration date, can become toxic. And I really do seriously mean that, toxic to your body. And so when doctors tell you that they want you to get rid of prescription medication, there really is a good reason for it. I've had a number of senior folks say to me, it's just a scam, it's a big scam, they just want to keep giving us drugs and getting more money and getting more kickbacks, and you could go on and on. Well,
I think you bring up an interesting point about expiration. There, in most most prescriptions, there is an expiration date on the prescription information that they put on the vial there that they're giving you. And so that, you should, if you take that, you've been keeping anything and you take it, you should look for that expiration date. And as Barbara's telling you, that should be a key.
The other important thing is every pharmacy has the ability now to use large print if you need it for the back of the vial, for the prescription itself. The script has on it very important information. Obviously, the dosage is the most important, but the expiration date, as Paul said, is another very important piece. And what I get from a lot of people is, I can't read it. It's too small print, I can't read it. You can ask the pharmacist to make that bigger for you, and most of them are very willing and of course have the ability to do that. So what I'm here to tell you is a couple of things. One, if you have old expired medication, please do not flush it down your toilet. Please do not put it in another container in your garbage, because both of those those solutions end up in our groundwater. How? Well, it's a long process that we don't have time today to go into, but what they have found is some of the fish and wildlife that are in our oceans and our bodies of water are becoming major deformed. And we have found that a number of women, especially here on Cape Cod, have gotten breast cancer. And they're tying a lot of these illnesses back to groundwater and coming from hormone type of pills. And there's a lot of pills that have that kind of medication in them. And it affects people's hormones. It's very, very sad, and it's very, very scary. So what can we do? Well, if you have any prescriptions that have expired, or your doctor changed something, maybe you took a medication, you had an allergic reaction to it, or you took a medication and it didn't function the way that the doctor thought that it would. If you have those prescriptions, please bring them on Saturday, October 29th to the Harwich Police Department. You can always call the Harwich Police Department and ask them if you have any questions about medications as far as is it something that I should bring. I have been told there is absolutely nothing that you can't bring, from an EpiPen that's expired to any kind of prescriptions. And I suppose that would probably also include vitamins and some of the non-prescriptions, because those are just equally as bad if you flush them. But Harwich is participating, as are many across our United States. And I just want to give you a really scary statistic. Last year, from Saturday, September 25th, 2010, and April 25th, 2011, 4,000 state and local law enforcement agencies throughout our nation participated in these Take Back Drugs Day, and they collected, are you ready for this? 309 tons of pills. That's a frightening statistic.
It's like a freighter.
But it's great news that they got that many. This, as you may imagine, comes from our drug enforcement, the DEA. And they have an office called Office of Diversion Control. How many of us knew that? But you'll see flyers throughout the community center and elsewhere in Harwich that have their name on the top of the flyer, and it says "Got Drugs" after the Got Milk commercials that we always saw. So, National Take Back Initiative, and it's Saturday, October 29th from 10 o'clock to 2 o'clock. If, again, you have any questions, you can either call here at the Harwich Council on Aging at 430-7550, or if you forget the time and date, you can give us a call, and certainly you can give a call to the Harwich Police Department. You can simply just walk into the lobby, and they will have a collection area for you. I think that's about it.
It seems that while we're on this subject, that recently I heard a news report where people went into homes to see how they were treating their medication, and they found that medication was not put away out of the reach of children or out of the reach of people who shouldn't have it. It was basically out in the open.
Yep.
And
very good
medications were not separated, they were together. So that might be something else that you could add.
Well, another important thing that we talked about up there in the Mass Council on Aging Conference are children, Alzheimer's patients, memory-impaired people, and animals. One of the ladies that was doing the seminar on this medications and expiration and all of that said that her best friend's puppy was not even a year old and died because the puppy got up on a countertop, got a brown vial, knocked it down, and it was either OxyContin or oxycodone, one of the pain medications that someone in the family was using, and the animal ate all of the pills and died. So it's a very, very serious situation. In addition, where do most people keep their medications if they have a little pill box? Where would you guess?
On the counter, probably.
Right, in the kitchen counter, right? That's like the #1 worst place you can keep them. Why? Because it's moist, it's near a water source usually. It's on a countertop that anybody can get to, from a child to a memory-impaired person. They should, and the other worst place is the medicine cabinet. Isn't that what we used to call it in the bathroom? Medicine cabinet? Well, with the moisture from showers and baths, that's also the second worst place to keep your medication. So it should be in a dry, closed area that has no moisture anywhere near it, because it can change, which I didn't know, the makeup of how the pills metabolize if they get moist. So put them away. If they're expired, bring them to us. We'll get rid of them for you. One of the interesting questions that came up when we were talking about this Got Drugs is things like heroin, cocaine, the illegal drugs. Some of the questions have been, what if that's in somebody's home and they know about it and they want to get rid of it? Are they going to be arrested if they go to the police department? The answer is no.
Just put it in a bag. Drop it in the box.
If you are courageous enough to bring something in that is an illegal drug, This is the same as, no questions asked. They want it brought in, and we do want to get it off the streets. It's equally as bad as the expired meds. So I don't know so much that we'll have that happen in Harwich. I hope not, but actually I hope so. But it was asked in Barnstable, and that doesn't surprise us. So if you have any questions, please don't hesitate to call us, and please make sure that your meds are away from your animals, children, and anyone who has memory impaired, because we don't want someone who's not supposed to have them getting into medications and becoming ill.
Very good. As Barbara mentioned here too, this is probably every 6 months you're going to be expect to hear about this, and in the meantime, you want to be putting these pills that you want to get rid of in a bag and up on a top shelf somewhere, so that they will be out of everybody's way, and you'll know where they are, and you'll be ready for the next opportunity to get rid of them. So thank you for this information, Barbara.
You're welcome.
And for you out there, take it all to heart. It's very important, and it could save lives.